move on to the next speaker. She is Pilocarpine Iyer. She is a PhD scholar. She will also be sharing with you some of her findings, PhD study, epilepsy insight from animal models. Pala.
Good afternoon all. So as a part of this 3 days workshop, I will be giving insights on epilepsy and sleep, insight from animal models. So our previous speaker has already given a very beautiful talk on how sleep and epilepsy is altered in human subjects. So I will give some insights on animal models. So as he has discussed earlier, epilepsy is one of the most common neurological disease affecting nearly 65 million people worldwide. It is often characterized by spontaneous recurrent seizures. And in addition to this, people with epilepsy will also have other comorbidities like psychological disturbances, cognitive deficits, and sleep deficits. So the exact cause of epilepsy is not known. It can be an acquired cause like infection or stroke, injury, and it can also cause due to genetic mutations. So there are different types of epilepsy, as sir has mentioned, like frontal lobe epilepsy, temporal lobe epilepsy, and so on. So it can be broadly classified into focal, generalized, and seizures of unknown onset. So one of the important epilepsy in partial is temporal lobe epilepsy, and it accounts for nearly 60 to 70% of total epilepsies. This sleep is one of the important sleep dysfunctions are. Okay. So sleep dysfunctions are common in patients with epilepsy, and epilepsy and sleep is known to have bidirectional relationship. So the most common defects which are observed in sleep are frequent awakening, daytime sleepiness, insomnia, and obstructive sleep apnea. So as I mentioned, sleep and seizures or epilepsy are bidirectionally connected. If there is sleep dysfunction, it can increase the seizure, and if there is seizure during daytime sleepiness or even the night, it can also impair the sleep quality. So in addition to sleep, sleep impairment or a seizure can in turn also leads to cognitive impairment and psychiatric illnesses. So thereby they all contributes to the poor quality of sleep. So we can use an animal model to understand the sleep dysfunctions in epilepsy. So there are several models which are used to understand sleep dysfunctions. One among them is the lithium pilocarpine model. So why this model? This model mimics most of the features of human TLE, and hence we have used this model. So in this model, we inject initially lithium 24 hours before the injection of pilocarpine. So lithium decreases the neuronal threshold, so a lower dosage of pilocarpine would be sufficient. Then after following lithium, we inject methylscopolamine. This is a muscarinic antagonist. So this blocks the peripheral effects of pilocarpine. We need pilocarpine effects only in the central, that is only in the brain. So the peripheral effects will be blocked by methylscopolamine. Then following 30 minutes of methylscopolamine, we inject pilocarpine at different dosages. This is to prevent the mortality. So if there is an increased pilocarpine dosage initially, that can lead to the death of these animals. So to prevent that, we give at different dosages. So if the animal do not undergo SC even after the first dosage, a second dosage is given after a gap of 40 minutes. So up to 4 such dosages are given. So if they do not undergo even after the 4th dose, they are considered resistant and are removed from our study or excluded from our study. If they undergo SC, we will retain these animals in SC for a period of 120 minutes. So here the pilocarpine used, it is an M1 agonist, that is, it is muscarinic acetylcholine agonist. So first acetylcholine receptors will be activated, and that in turn activates the glutamatergic system and thereby increases the excitotoxic cell death. So once the animal enters SC, so SC is nothing but it is status epilepticus. That is, if the seizure is prolonged for more than 5 minutes, we call it as status epilepticus. We allow the animals to be in SC for a period of 2 hours, and following this, diazepam is given to halt the seizure. So during this SC, the severity of the seizure is graded based on 1 to 5, where 5 being the highest score. So these are the images to show the different stages. This is stage 3, stage 4, and stage 5. And so once the animals undergo SC, they will be in a period called as latent period, during which no behavioral seizures are observed. And after this latent period, they enter into the chronic phase, during which the unprovoked spontaneous seizures will develop. So this is a video to show that how the spontaneous seizures occurs. So here we can see that these animals the rat is in sleep stage initially. Okay, so here I will show you the rat is in sleep stage. Following this, there is a pre-ictal stage where the spikes or the pre-ictal spikes will be present, especially in the hippocampus. And following this, the animal enter into a ictal phase. So it is during the ictal phase, the animals show the increased seizures or behavioral seizures. And following this, there is a relatively silent phase called as post-ictal phase, during which only the spikes or interictal spikes are present in a low background activity. So we wanted to address whether the sleep is an initial event or it is a late event. So we know that sleep and epilepsy, they are interlinked, but whether sleep begins when seizure develops or it is a later event. To understand that, we implanted the animals with electrodes and then gave a recovery for 10 days. Following this, we did a baseline recording and then we induced these animals for SC induction. And following this, we recorded these animals on 7, 14, 28, and 56. So here 7 and 14 represents the latent phase and 28 and 56 represents the chronic phase. So accordingly, we had these 4 groups and we classified the seizure sleep based on wake, NREM, and REM. So this classification, yesterday Dr. Neeti has already described how we classify wake, NREM, and REM. So I am not going into this detail. And what we saw was the wake was significantly increased on day 7 and 14, whereas it reached to the baseline on day 28 and 56. So the effects are more pronounced on day 7 and 14. And these effects are predominant during the light phase than during the dark phase. And when there was an increased wake, we also saw a decreased total sleep. So to understand which sleep stage was affected, we later looked into NREM and REM separately, and we found that NREM was not affected, whereas REM was significantly affected on day 7, 14, 28, and it even persisted on day 56. Unlike wake, which was seen only on day 7 and 14, that is only during the latent phase, whereas REM was seen from day 7 and it was persisted even on day 56 of the recording. And this is the hourly data where we can see that the REM deficiency was seen especially during the light phase than during the dark phase. And this was persistent on all days, even on day 28, whereas on day 56, this reduction was seen especially from 12 to 6 p.m. Then to look into the sleep stability, we looked into the bouts or the cycles, and we did not find any significant difference in the wake bouts or the wake bouts, whereas the NREM bouts was significantly decreased in these animals. Then we saw that REM bouts were also significantly decreased in epileptic animals, and it was decreased on day 7 and persisted till day 56, whereas the REM mean bout duration was not affected. So what are the current challenges in treating epilepsy? As Dr. Sanjeev Sinha has already mentioned, anti-seizure drugs forms the first line of treatment, but among that, although 64% of them respond to the drugs, they are associated with adverse effects like cognitive decline and sleep disturbances, and rest 36% of the patient do not respond to the drug, and among that 30% are known to have sleep disturbances. And there is an urgent need to develop a novel therapeutic strategy, or using a non-pharmacological approach will be beneficial in ameliorating these sleep deficits in epileptic patients or animals. So in a previous study from our lab has shown that enriched environment to be more beneficial in several neuropsychiatric and neurological diseases. So enriched environment is a large cage which consists of toys, tunnels, ladders, and wheels. And this is known to improve the cognitive function, psychomotor stimulation, and it also provides novelty to these animals. And several reports from our lab and even from other labs have shown that they decreases the behavioral deficits in animals in neuropsychiatric diseases and also in neurological diseases like Alzheimer's disease. And this is a study from our lab by Brinda et al., where she has shown that exposing these animals, exposing the epileptic animals to enriched environment, even at the chronic stage, decrease the seizure episodes and duration, and also it decreases the depression-like behavior. In addition to this, she also reported that there is the altered anxiety caused by these epileptic animals were also ameliorated by EE. So in addition to these results, a recent study by Salaka et al. Has also shown the basal synaptic transmission, which is required for the normal communication or neuronal communication, is also impaired in epilepsy, and this is reversed following EE. So since there are several benefits of EE, we wanted to check whether EE is beneficial in reversing the sleep deficits. So for this, we exposed these animals to EE during the chronic stage, that is from 7th and 8th week of epilepsy, post-epilepsy induction. We exposed these animals to EE for 6 hours per day for 14 days. And we found that the REM, which was significantly decreased in epileptic animals, was reversed following EE. And in addition to REM, enhancing the REM duration, it also decreased the REM latency, and it also decreased the REM latency. In addition to this, the REM bouts, which were also decreased in epileptic animals, were reversed following EE. So these results suggest that REM duration, which is affected in epilepsy, is indeed reversed following EE. In addition to this, we also saw the REM transition, NREM to REM transition was reduced in epileptic animals. This was also reversed following EE. So coming on to the summary, so we can say that epilepsy is indeed affects the sleep or epilepsy affects sleep, and this is very well noticed in our model. So we can say that epileptic models, that is especially this pilocarpine model, can be used as a very good model to study sleep changes in associated with epilepsy. And we saw that epilepsy is or sleep impairment is an early event. It starts as early as 7 days in pilocarpine model, and it persisted till 56th day post-SC. And this decreased REM duration was indeed because of the decreased REM deficits rather than decrease in the REM duration, REM mean duration. And exposure to EE was beneficial in reversing this REM latency and also the REM duration. So in addition to this pharmacological treatment, a non-pharmacological approach like an enriched environment or physical exercise or ketogenic diet might be helpful to reverse these sleep deficits which is observed in human condition. However, a further understanding is required to check what is the effect of these for non-pharmacological approaches in epilepsy-induced deficits. Thank you.